So some of the key considerations in psychological assessment tools is, to quote, they are standardized systems that help to identify and gauge the extent of specific conditions. And we've covered in some detail, we've talked about some of the ones that agencies use to identify levels of anxiety and depression and psychological distress. We've briefly discussed Beck's depression inventory, Beck's anxiety inventory, the GAD-7, and the Core 10. Some points to consideration is how they're used in counselling agencies. Well, these aren't exhaustive, and it's always a good idea to check with the policy of the organisation you're with. Some of the things that we've sort of touched on today are an intake form, so they can be filled in or filled out before the client is assigned to a counsellor. From an intake perspective, it can be gauge severity of symptoms, assess risk level, and can potentially help identify which counsellor the client should be assigned to. In terms of mid-series of review form, it can form part of the review mid-sessions, used to assess progress and potentially used to justify a potential referral if no progress is being made. From an exit point of view, the exit interview, they can form a part of the final review. They can evaluate the efficacy of the counselling modality or counsellor and can be used to justify potential further funding, and can also be used in larger potential research projects. These aren't necessarily exhaustive, but they are some sort of guidance for your assessment. One point to take into consideration, and one thing to sort of consider, do they take up valuable counselling time? They take up time with the counsel outside sessions, the structure, the session, and potentially move away from non-directive approach. Potentially the counsellor might start to work towards improving scores. And I guess there's the added potential considerations of self-report and reliability and validity of self-report measures for the client. So this could be anything ranging the client understanding the questionnaire. Also, the client may want to sort of have resistance in terms of giving scores for the counsellor, or potentially they may be over compliant, and potentially also the client may want to sort of extend their counselling and potentially report negatively. So these are no means exhaustive, but they are and should give you some guidance in summary for today's lesson.